Yes, hello everyone. Thank you for joining us for today. I am Dr. Nhlakanipho, and our show is starting right now. All right, let's start the show. Thank you for joining. All right, and again, welcome to Dr. Nhlakanipho Talks Health and Healthcare Systems. I know that it's been a while since I've actually had a live streaming show. Last week we had a technical problem and we could not actually show our show here last week. So today we're making up for last week and we're coming out very, very strong to talk about the issues related to health. Now, let me remind you that we are actually a show that brings about the knowledge and information that we think that both the healthcare workers and the public needs to be aware of. And this is not really the what I will call the opinion of any department. This is a personal opinion from myself, Nhlakanipho, when I look at some of the issues and also reading through some articles and watching some of the things that are actually happening around us. So it's important for me to actually highlight that whatever information that we share on this platform, it's actually a very personal platform, and I hope that actually you can engage with us in order for you and me to attain the knowledge that we need to attain so that we can make wise decisions moving forward. But again, let me welcome you on this platform and to thank you for joining us today. And let me also just say that today we are looking at a very fascinating topic, but not necessarily to most of the people, I would presume. But I would think that this topic would be relevant to maybe aspiring medical students or medical students or even doctors and nurses and everybody who works at the community level. But most importantly, politicians as well. If you are a counselor or you are interested in running for any elections of some sort, or you want to be a community leader, I think that the discussion today will touch on very social issues that I think that we need to be aware of as people that will make us make decisions that will actually benefit the people on the ground. And well, of course, I think that let's not waste time today and actually go through with the talk. This talk is going to be very, very short today, and I hope that we can engage on the Facebook platform. You can either send me a message or you can actually comment on the comment section below. In this live chat. We are not on Zoom platform today. We are broadcasting from the OBS platform live on Facebook for you to get the information that we want you to get. Today I'll be acting as a director and also as a presenter, so do bear with me. It's a difficult job, but I will try by all means to actually show you the things that I need to show you so that we can then follow through with the discussion. Well, of course, today we are talking about social determinants of health, and I think that for me it's very important that before we do anything, maybe I would want to try and perhaps maybe define what social determinants of health is, and I'll be helped by the World Health Organization on this, and obviously they would define the social determinants of health as the social determinants of health as the conditions in which people are born, grow, live, work, and age. And these circumstances are shaped by the distribution of money, power, and resources at a global, national, and local levels. The state social determinants of health are mostly responsible for health inequities, the unfair and avoidable differences in health status seen within and between the countries. Now, when we talk about this, I think it's important for you to actually then be able to note the fact that I think that you and me already know that there are differences between the countries in terms of how we provide healthcare services. And as the definition really of the social determinant states, that we look at the environment at which one lives, which predisposes them into this unfair, discriminatory background that they come in. And you might have heard a lot of people talking about, I'm coming from a poor background. Why is that even necessary? I mean, I never wanted to be a doctor for once, but I know that there were people that actually were in the rural areas that wanted to be doctors. And because of the social environment where they were, even if they wanted, it was almost a crime to even think that they can become a doctor, for instance, because of what they are exposed to. Nobody's talking to them about this. They don't see anybody being what they want to be. Therefore, they are bound to think the way that they think, to say that we cannot become this and that, because obviously, this is not what we are meant to be. And in that way, the dreams of a child are actually capped into a certain expectation that is not the same as the child that is born or lives in an urban area and who goes into a better school where there are better resources and career guidance where they guide them on some of these issues. Now, I'm trying to explain here the rationale of the environment at which one actually is born in and lives in and age in, and the resources and the distribution of course, the money and all of that. I think that poverty is something that we should not at any given point look as a distant, factor to ourselves. At any point, one can just crash, and everything that you have, you lose everything, and then you lose your house, you lose your car, if you do have, fortunately. But you can be living under the bridge like a hobo, and that you cannot predetermine. And I think that poverty is a great thing, and it actually causes what I would call lack, or rather, it doesn't make people live in dignity when they live in poverty, because you see a lot of things that people do when they are desperate about things. Things like, somebody was saying on Facebook the other day, I think it was Dr. Mgomezulu who wrote something that actually touched me about poverty. And he says, sometimes we are too distant to poverty in a way that we don't feel a thing when we see somebody digging in the dumpster, for instance, to search for food, because they just don't have food at all. And I think those are some of the things that we know. We know that people, are living in poverty, but we somehow are not conscious, or rather, we are ignorant of the fact that it's really happening, and people are actually, living under the bridge. And it's even worse when the health of individual and how you access health is dependent on how much you have in your pocket for you to receive the quality of health that you so desire. But I think I've explained that, and I want us to just to have a look at something that I think that is important. And this thing actually is what then I will call, the actual social determinants of health in terms of the pillars. What are we talking about when we talk about all of those type of things? And these are general socio-economic, cultural, and environmental conditions that we're talking about, as explained in that WHO definition of social determinants of health. And let me just show you something that would maybe just give you a clarity in terms of, what issues are we talking about, particularly when we talk about social determinants of health. So just bear with me, and let's see if we can actually see this. All right, now this is what we're talking about, and I like this diagram because it actually shows us in terms of the pillars that social determinants actually look into. These are all the things that would have an impact in somebody being healthy, or in making sure that we provide high quality healthcare services to any particular society or country and the world. Now, this to me is very important, because if you are working in a community and you are working whether as a social servant, or rather whether you're working in a hospital, or you're working at a school, or you're working at a home affairs department, and if you don't know what social determinants of health are, I'll get very, very worried. So if you don't know what social determinants are and you're working in a public space, make sure that you actually go to the CDC website somewhere where they talk about this. And I think you will get a lot of information that I think that you should be able to actually note. Now, but importantly here, I think that for me it's important to actually highlight some of these things, and really I'm hoping that you can stay with me as I define this, because it is that important and it is that relevant. It will help you, it will help the people close to you, and it will also help the community that you live in. If you understand this, then you will understand why we need to vote, for instance. You'll understand why we need to form part and parcel of the community structures in our own communities, and to make sure that we shape it. Why should we form part of discussions around, for instance, where we talk about salary wage discussions and all of those type of things? Why is it relevant to us? So if you don't understand this, I will find it hard for you to actually get into these discussions. That's why I think it is important for us to actually be able to discuss this with you. Now, as I've mentioned, there's one thing that we spoke about just now, and that was about poverty, for instance. And poverty is really related to what I will call, the hunger in the society that we see. But it is very sad to actually see hunger in young and children in our communities, where they come in our hospitals already with malnutrition because they just cannot afford healthcare services, or they cannot afford food, for instance, to give to their kids. And most of the time I drive down when I go to town, and somewhere in the robot there I see a mother and a child sitting down, and the mother is begging for food. And I'm thinking to myself, goodness, what is happening in this world? And I see this child, maybe it's about 1 year or 2 year old child, with his mother sitting in the robot. It's cold, and I'm thinking, I'm troubled by what I see. The question is, does it trouble you at all to see people living in poverty, to see people hungry, to see people begging, and all of that? Is it something that is really, that we can say, no, it's not, it's something that is normal in our society? I think it's not, and we've normalized it. And I think we should actually just get rid of that ignorance. That is not a normal way of people of living. So we should just put that in our heads for once, and to think about ways at which we can actually contribute to make sure that that doesn't happen in our societies. Now, so it's agriculture and food production is very important. And I know that many people with the BEs and the land issues and all of that, people are looking at maybe investing in some of these things, and to guarantee our country really food production, the maize and all the other things that we actually see in the farms. I think it's important that we know that actually this would constitute food security for our country, and without food, we will die. So I think it's important that you realize that we need farms, we need people that work in the farms, but we also need to negotiate good salaries for people working in the farms that actually make us to eat food that we buy in the shops. Now, there are many issues about education, I think, that are practical for us, and education is one issue that I think we should be actually looking into, to talk about, how we access education. And education in itself is not just education, but we are saying here, we want to talk about the quality of education that we provide to our kids. We want our education to also be equal to the kids that are in the urban areas. It doesn't make any sense actually to differentiate between the type of education that I get in Bazwana, KwaMhlabelingana, where I come from, and the quality of education that somebody gets when they go to St. Nicholas School, for instance. And already you are predisposing me into a different system and making me to think in a different manner. You almost are conditioning me that this is the level at which I can actually think. Therefore, the equality and the quality of education in this regard is very, very, very important. Now, I went to medical school, and I went undergrad. In my primary school, in my secondary school, I was in a rural area, and we used to laugh each other even when we attempt to speak in English. So you can just understand how much of, discriminatory, view our society has when you try by all means. I remember there were kids at school who were really trying to speak in English, and everybody used to laugh at them. And I never used to understand why, because this was not for them. And immediately you start speaking in English, then you were seen as somebody that, was mimicking to be something else. But that had a huge impact when we go to university and varsity. And if you've never touched a computer before, and now you need to do your essays, you need to do your presentations, and you need to do all of that, you are seen as being slow. Not because you are slow, it's just because of the environment at which you come from. Therefore, education in itself plays a very critical role in terms of making sure that our society actually makes sure that that education is actually made to be equal everywhere in the country, everywhere in the world. We get the same level and the same quality of education. Therefore, we will have the same opportunities in terms of our space at work, at university, and everywhere else. Now, I won't dwell much on the work environment, because the work environment talks a lot about the roles of managers in the workspaces where we are, but most importantly, the policies of government and the bargaining chambers in making sure that they actually address the issues of work environment, both in the public and the private sector, of course. And I think that plays an important role in making sure that people are actually being paid, better wages, and also they are also treated with dignity that they deserve. And I think also they need to be working in a safe environment, and that one we cannot even argue. Now, the issues of unemployment in this country, I think recently we know very well that, in the quarter that was being assessed, we increased the unemployment rate in this country. And this is the big topic because, when you talk of unemployment, you actually talk about, the issues of people unable to wake up and have a purpose to say, I am going to work today. I'm going to work to make money so that I can come back to be able to buy things for my family. Start up with maybe to buy a shelter, maybe to guarantee your family health services, maybe to guarantee your family good education, and all the things that they need. Employment is a very important thing in the society. And if you are employed, then you can contribute into, the bigger tax collection, and to make sure that other people who do not who do not have, can actually get through the social grants and all of that. And later on, we'll talk about social grants and what they mean and why do we even have social grants in our population. Let me just quickly go to this point again now, where I would now talk about water and sanitation. Water and sanitation is very, very, very important in our society. And I wish that we can be able to know that these things are actually all the things that are non-negotiable. You cannot live in an environment where you do not have access to water and sanitation. These are important pillars of health. This is what shows the dignity to a human being. And so for me, it is important to highlight this, because if maybe you are an aspiring counselor in your community and you are an aspiring community leader, just make sure that the issues of water and sanitation are actually prioritized in your community, because these are very, very important. And not just water and sanitation, but also the housing factor is very, very important. I'll make a good example that I always make with somebody that comes in to consult me of TB. And they come in obviously presenting with the symptoms of TB. And what I then do is I actually then diagnose them with TB. It's either I do it with a sputum, or I send them to an x-ray to do a chest x-ray and all of that. And then eventually I'm able to tell them that they have TB. Now, for me to start treatment on this patient is dependent on whether or not they are able to take that treatment, right? And I then engage with this person and I say, the reason why we're putting you on this treatment, this is the only way that you can get better, and that I need you to actually, to be compliant on this medication. After a while, I then send the patient home, and I don't realize that actually it's not so much about personal issues, but rather the social issues that are impacting on this patient. And then you'll find that they live in one house. It's maybe 6, 7 of them sharing space in a space that is even not well ventilated. And then I pride myself as a doctor to say that I have treated this individual. Yet, few weeks down the line, somebody else from the very same house is going to come back again with TB. And then somebody else again, and then somebody else again, because they continue living in the same environment. Now, I'm asking myself as a doctor if there's any role that I can play to change the situation at home that will guarantee that this person never comes back again, or any of their family members do not come again. So for me, it will be important to go to that household to check for. I will do what I call the family or the household, research, just a mini research to see what is going on. Where do they get water? What the issues around sanitation and all the other things, and then I'll be able then to say, these are the things that we need help with. But Department of Health is not going to offer people houses. It's not going to offer people access to water. And this really brings me into a strategy that was brought to the department to actually in the health sector, but also I think in government in KwaZulu-Natal, and that system is called Operation Sugumasaki, that I will just describe now for you to know. And if you don't know this, I've driven around in KZN and I've seen a lot of halls with a board written a war room, or rather an Operation Sugumasaki, OSS. And you wonder what these things are. And these things actually are linked to the social determinants of health. And if you don't know these things, know them. Go to your counselor, go to your mayor, talk about these things, and actually use those resources effectively. And I'm linking these purposely because I know that people are saying, no, but what is the government doing about this and that? We have strategies in place. The question is, are we using it for the right reasons? Are we using it to address the socio-economic issues that are in our communities? And I think this is important. Therefore, I think that, those are things that it just encapsulates, some of the issues that we actually have. Lastly, it's about healthcare services. And I know this is a big topic, the healthcare services in itself. And I wouldn't be doing justice if I don't talk about them in the social determinants of health. Let me tell you something. So WHO has agreed that, we need to establish universal health access, or rather universal access to healthcare to all people, irrespective of their socio-economic status. And that is important. Now, in the Southern Africa, we've got a system of health that is divided into two. Basically, you have a private system and you have a public system. What we know and what has been said many times is that our private healthcare system, presumably, it is providing a better health. Well, that's what people say. And our public system is not so much. But what we don't realize is that our public system actually caters for the amount of people in percentages of over 80% of the people in this country. And the public system also takes over some of the people that are rejected by the private system once their medical aids are exhausted, and then they say, go to the public sector because we cannot keep you here because you don't have money. You see, now, when you have a situation where your health is gambled with based on how much money you have in your pocket, it becomes very problematic. This is a non-negotiable issue. It's health. I think then this then brings us into the conscious ability to know that the national health insurance, or whatever that is called, is necessary for the peoples of this country. How we deliver that or how we implement it becomes very questionable. But this is necessary. We cannot argue that. So it is important for me then to say that one day I will, as promised previously, to say we will talk about national health insurance that seeks to address some of these inequalities that exist between the rich people and the poor people and how much can we do to make sure that we balance that equation out and increase the quality of health. I think health in itself alone as an access is not enough, but what we really need is to provide our people with the quality of health care that we can ever provide to them. So I thought that was important. So I think I've exhausted the issues around social determinants of health, and I wish that maybe we can then maybe look at some other issues some other time. But it is important for me to highlight that there are issues around social and community networks that we need to establish within our community for us to be able to address some of these issues. And also there are factors that are individual and lifestyle factors that we cannot forget when we talk about the health of any individual. And I think for me it is important to talk about the age and differentiations, for instance, the children, the teenagers, the adults, but also to talk about the differences in, females and males, and the discrimination that exists in the workplace between the males and the females, things that they are subjected to because they are females, for instance, and all of those type of things. And also the other constitutional factors that exist within our communities. But most importantly, I think the behavior of individuals is very critical. We've seen this with COVID-19, that many things have been put in our hands to take responsibility to wear a mask, to wash hands, to limit, and all of those type of things. That would predetermine whether or not we're moving into the third wave or whatever the case may be. And it seems to me that we are not taking that very responsibly as people. And I think that we need now to start looking at an issue where we are able to take responsibility for our own health as people. Before you can actually get into a hospital, you need to have done something yourself that proves that you want to live a longer life and a healthy life. And I don't think that that should be a responsibility in itself, fully or entirely of the Department of Health, but rather we need to be able to provide you with the relevant information, and then you make wise choices. And this to me relates to maybe your choice, personal choice of smoking, or personal choice of indulging in alcoholic beverages, for instance. And those are really the things that we need to discuss on. But also, I think, together with this, the other issue that I think is very important is to look at population control. I was looking at this video at some time back, and I would share it some other time, that showed that the countries where people or families have more kids or children actually were more poorer than the countries where they have less kids. And I made reference previously on a country like China that put policy in place to look at some population control for them to be able to boost the level of the economy that they have, and they are doing wonders. And again, the question is, are we actually open to population control in South Africa? Yes or no? Now, let me move further. I know that we've taken quite a few minutes now, but I think that for me it is very, very, very important to then go and actually discuss some few issues and few issues that pertains to what we have in our country. And again, I've alluded to this before, and we speak about the Operation Sugumasaki, the OSS. I want you to know today that the OSS is there to address some of the issues around social determinants of health. And make sure that you put those people to task. Make sure that you know that there are committees called local AIDS councils, district aid council, that seek to discuss issues around TB, HIV, and hunger and poverty and crime in the society, rape cases that we see every day. And I think if we are not aware of these things, we are most likely never going to achieve the 2030 vision. So it is important for us to know these type of things, that actually, we can actually use some structures that exist, especially here in KwaZulu-Natal. We do have this, and I'm going to show you just now a document that talks about some of these things. So let me just see if it's possible for me to actually show you this document here that talks about some of these things. And let me just try and move with speed here, so that I can show you this. So let's now have a look at the vision, the mission, as well as the overall aim of the Operation Sugumasaki. And again, I mean, comment down below if you've heard about Operation Sugumasaki and if it works in your community or not, and how you see it, and just let us know how you have seen it working and what type of examples that you've seen it actually functioning in your community. It would be great to actually know. So the vision, obviously, for Operation Sugumasaki, it stipulates that together, sonke sindawonye, right, with committed leadership, creating sustainable livelihoods through the provision of integrated services to communities, promoting a better life for all. Now, that is the vision. The mission is to provide a comprehensive, integrated, and transversal services to communities through effective and efficient partnerships. And this actually talks to some of the things that I would say they are very, very important, because they are responding to the issues at the community level. Well, they do say that the overall aim of OSS is to rebuild the fabric of society by promoting human values, fighting poverty, crime, diseases, deprivation, and social ills, while ensuring moral regeneration, and by working together through effective partnerships. Now, partnership which include civil society, religious and traditional leaders, vulnerable groups, the businesses, development partners, communities and government departments, all of whom work together to provide a comprehensive, integrated service package to our communities. Now, no one dare criticize me when I then say that there's no reason why today we have Ukoko who's been living in a house that is falling for over 20 years. When we have such structures that exist within our society, when we have people living in those societies, people have made it a norm, and that's it. And they cannot even engage people within the community and the community leaders to discuss how can we take that gogo out of that misery. What is our use? Have we made this a norm? So we need to advocate for each other at a community level for us to live a better life. But it seems to me that we get joy when other people are poor, when instead we want to punch them under the belt and to get them poorer and poorer. And I don't think that that will take us anywhere. We need to think about each other in our communities. We need to be able to advocate for each other and to use the resources that are at our disposal for us to change the conditions of living for our people. This, to me, is very, very important. Now, let's look at the objectives, though. The objectives of the Operation Sugumasaki. And let me just show you some of them again. Now, the overall strategic objective is to integrate, coordinate, and facilitate transversal services to communities. And for OSS to achieve this, they have to have made a distinction between the 6 sub-objectives that seek to address some of these issues. And basically, that number 1 is to create and maintain functional task teams at provincial, district, local, and ward levels to deliver integrated services to individuals, households, and communities. And I've spoken to this, to say we need to have that system for us to be able to respond to these issues. But most importantly, create fully efficient and competent OSS human capital structures across all levels of the OSS implementation, and to understand and identify pockets of poverty and social ease within the wards. And I've said this again in the example that I gave, to say, who is advocating in our communities to say this person is not doing well, therefore we need to take them out of the misery? One other thing that is number 4, which is a sub-objective, is to provide comprehensive, integrated, transversal services to the communities. Obviously, here we talk about different departments, whether you talk about Department of Health, Department of Social or Child Welfare, or you talk about like a department like Education, or you talk about, a department like Security, SAPS, South African Police Service, or whatever the case may be. I think it is important for us to know that if we do not work together, sit in one boardroom with all of those departments, we're never going to get anything out of what we are trying to do. Now, we need to advocate for OSF involvement for all stakeholders through marketing and communication. We need to talk about this, and I think this is what I'm doing today. I'm actually here today telling you that there are structures that exist within the society that can be used to change the livelihood of people and to address the social ills that exist in our communities. And we have a structure that was endorsed by the then Premier, Dr. Zweli Mkhize, who actually came up and presented this. So this is something that is very old, but it exists, and I wonder if you know about this. The other thing that is important is then to monitor and evaluate and provide feedback and track service delivery. So if City, we came in and we presented in a war room and we said, Ukoko X is suffering, doesn't have shelter because of 1, 2, and 3, we present that. We come up with resolutions. What are we going to address? What are we going to do to address that situation? Then we are able to go back and track and fast track and see whether or not we are actually providing this. It gives me comfort, a lot of comfort, with the new MEC, ABC, Ubabusoto Bucho Musubia, who has actually hit the ground running when it comes to these issues and responding to the real issues that are happening in our communities. I think that, to me, is a response to the existing Operation Sugumasaki in our communities. And that's exactly what we need. We need a responsive government. And for a young person like MEC Sibia to actually do the things that he does, it is actually very motivating for me to say that we are actually seeing these things now being responded to, because we live in this society. Now, the most important part is to monitor the progress of the prioritized needs taken forward with the designated focal referral persons to ascertain the progress made with the cases and to provide feedback to the community at the ward level. Ngeke uzukwazi ukuhlala kunogogo owazi kahle kamhlophe ukuthi akakutholi ukudla, ulala engadlile okanye uhlala yedwa and uyagula akakwazi ukuhamba, akakwazi ukuzenzela lutho, and sleep in your own house and be comfortable with that situation. Umdlule kwakhe, umbingelele, knowing very well ukuthi akadlile lutho. When OSS, the Operation Sugumasaki, exists to respond to such problems. So I think maybe then this is the time for me to show you maybe what groups of people can actually benefit from the OSS. Maybe this will somehow show you something that I think is actually important. I'm not sure if I'll be able to actually show you some of these things, but if not, then I think that it's important for me to actually pack it here, having spoken about issues that I think are very critical and important, but also I'm really hoping that you are listening to this with a great deal of enthusiasm, but also with an open mind to know that these things are actually necessary for our country. And maybe let me just take this time to also then look at what I will call the comments that are on Facebook before I close. It is important for me to actually, engage with you, to also learn what you think about the topic. And again, I wish to thank you very much for listening and to tune in when we talk about these very important issues. And so at this point, I would like to go through to my Facebook and just to read some few comments for you. Andres, Dr. Moshai right there actually says that thanks, Doc, for the great show. Though I wish you could have expanded on the issue of poverty to the mental level, not only respected to the lack of material or food in particular. I think Andres is actually making a very important point here, because I think that we underestimate the social, psychological aspect of poverty in itself and the things that it does to people that live under those conditions. And I think this is very important. I think that if I missed out on that, I think it's an important point that actually poverty has got an impact both to your physical being but also to your mental well-being. Because of poverty, it can cause a lot of harm, other than just your physical harm, but also your mental, psychological issues that actually comes with that. So mental issues indeed, Andres, I think you are right in that sense to say that we can actually have, some things that, can actually develop on your mental level when it comes to the issues around poverty, including suicide, for instance. When people feel like they can't afford things, they start thinking about killing themselves, thinking that they are actually, freeing themselves of this misery of this world. And I think those are the things that we actually need to talk about. But I think, again, thank you, Andres, for that comment. I think you are spot on that matter on the issue of poverty. And Ubonga Koza comes in here and says, great topics, Dr. Gumede. And thank you very much for tuning in, Dr. Koza. I think it's important for us to talk about these things. My wife is commenting also on Facebook. She's at work, so she's not here with me. Ulin Gumede. So she says that individual lifestyle factors play a major role in the social determinants of health. For every day that we eat fast food, and for every day that we do not exercise, or even day that go out without sunscreen, we add pressure on the health systems without future lifestyle diseases that we are definitely going to develop. I think this is very important. I'm a culprit on this, and my wife knows it, but maybe she's just dissing me on this platform today to say eating fast foods, for instance, is very critical, and exercise and all of those type of things. I think that this is a very, very important point that seeks to say that actually our own behavior, and I've alluded to this to say that our own behavior plays a very, very important role in how we eventually become a healthy nation in the future. So, and again, thank you very much to everybody who commented on this platform. And for me, I think for now, I need to leave it here and to say that thank you for joining us. And again, next week, we will be talking about more fascinating topics on health issues. And again, this is Dr. Nhlakanipho Gumede, Talks Health and Healthcare Systems. We say bye-bye and have a good Saturday today. Peace.